So my name is Meghan Luczkowski. I am both a physical therapist and athletic trainer for Mercy Sports Medicine. So I've seen concussions on both the pre-injury side, where I've been on the sideline diagnosing, and then I've been on the other side treating them after they've gone and seen a physician. I'm here to present on behalf of Dr. Kamal Ashraf, and we're going to talk about knowing when to advocate for the youth who have concussions. So first off, in order for us to advocate for them, we have to know why they may not be able to advocate for themselves. And some of this, first and foremost, may just be because they have a pure lack of education and knowledge on what a concussion is, the severity of a concussion, and the symptoms associated with these concussions. If they've never had an injury like this before, or they've never witnessed an injury like this before, they simply just don't know how to advocate because they haven't experienced it. Secondly, if they do understand the risks and the seriousness of a concussion, they may not advocate for themselves because of other reasons, including sport and social pressures. So some of these pressures that they feel that they don't want to pull themselves out of sport is because they don't want to let the team down. They don't want to look weak in front of their teammates or their coaches. They're fearful of what their coaches may think of them. They're fearful of losing their positions on the field or their spot on the team. They don't want to jeopardize their future sports career by not being able to play currently, or it's just a really big game and they just don't want to miss out. So those are some reasons why they may not pull themselves or advocate for themselves when they suspect that they have a potential head injury. Our job here is to help equip these athletes with the knowledge and the education so that way they can advocate for themselves, but also we can help advocate for them. So next, there are two different types of concussions, a non-sport related concussion and a sport related concussion. And they may have different reasons why they may not report these injuries. In 2014, the American Journal of Sports Medicine did a study that showed that 69% of athletes with a possible concussion continued to play despite having symptoms of a concussion, and they reported that 40% of the coaches had no idea. So this is a pretty high number of athletes that are continuing to play despite having symptoms that coincide with concussion. So we know it's a problem. But why aren't these kids reporting? So part of it is because of what we talked about earlier. There's pressures to continue playing despite having concussions. They don't want to let anyone down. They don't want to jeopardize their spot on the field. But there are other reasons as well, as that they don't know the seriousness of why they can't continue playing despite having these symptoms. There is a degree of subjectivity with concussion. So when you're evaluating an orthopedic injury where a bone is sticking out of your body, it's pretty easy to say, like, you can't go back in. But when the symptoms are a little bit more in the mind and you can't visibly see them, it's a hard sell sometimes when an athlete is talking to people who, coaches, athletic trainers, parents, who may not be able to visualize what's going on inside their head. There are protocols in place to help avoid this lack of self-reporting. So 47 out of the 50 states do have some sort of law requiring that if you have a suspected head injury, you're required to stop playing right then and there. However, it's up to the parents, the coaches, the athletic trainers, whoever's on the field at the time, to know that they need to be pulled out of play. So that's what we're here to learn about all day today. And it is difficult to apply these protocols that are in place, sometimes because there aren't athletic trainers on the field. Most schools and most tournament complexes have some sort of healthcare providers that are on site now, but not every one-off game that's played on one Saturday and then you have a game next Saturday, they may not have a healthcare provider directly on site. So this is where parents and coaches come in to help advocate for their youth, because they're learning, or you guys are all here to learn what those symptoms are. So that way you can be that person that can help pull them, so that way they can continue to be safe and not play through concussion symptoms. Now, on the flip side, there are non-sport related concussions. So these are anything that occur outside of an athletic event. So it may not be as obvious, or it may not be seen by a coach or a teacher or a parent, because it's not during an athletic event. So a study in May of last year, 2022, by the Concussion Alliance showed that 62.4% of college athletes, so the last study was done in high school, this one's done in college athletes, showed that they did not report a non-sport related concussion, whereas those that were in sport, 48% did not report. So the numbers are still pretty high, but it is more likely that they will not report if it is outside of an athletic event. And this could be for a multitude of reasons as well. First off, they don't want to get in trouble. So especially in the college setting, injuries that occur outside of athletic events sometimes get kind of looked down upon by coaches, athletic training staff, because they may be letting the team down if they can't participate because of something they chose to do outside of sport. Other reasons they don't want to get in trouble is maybe why they had this concussion is for something that they were dabbling with that's a little risky behavior, or recreational substances, or just a physical altercation. So they don't want to get in trouble with the law, but also with their team, their parents, their coaches, their healthcare staff. Other reasons may be that, especially in the college setting, if they're outside of home, they may not know the resources available to them outside of their direct athletic training staff or healthcare providers within the college setting, but also, or just what's in the community. They're not quite aware of what they have access to. And then financially, especially in college setting, they may not have the resources to pay for healthcare services on their own if they're outside of the house. And finally, this may allude to some personal complications that they may not want to divulge that information to public. So if there are reasons why they're getting concussions or having concussive symptoms that relate to abuse or a tricky home life situation, they may not want to divulge that that situation because they don't have that trust or that rapport to someone to report safely. So those are some reasons why people may not report non-sport related concussions, although it is not quite as high as what we've seen if you compare the two studies, different settings. So this is where we all come in. We have to help to advocate on their behalf. So this is everyone from parents, coaches, athletic trainers, school nurses, administrators, counselors, teachers, and all healthcare providers. So how do we do that? First and foremost, we need to have an open communication with these athletes and create a supportive environment where they feel comfortable and trusting to come and tell us this information where they may feel that they have concussive symptoms. We need to be empathetic and understanding despite whatever situation occurred that caused this concussive incident. And we need to build trust and hope within these athletes so that they continue to come to us with potentially confidential or information that's a little bit more like personal. So then once we understand that they may potentially have a head injury, we then need to direct them to the correct personnel, which a lot of the presentations earlier today have kind of talked about who those personnel might be. So I'm going to go through the 4 R's, which are recognize, report, recover, and return, on how we can help advocate them and how we can put this into action. So the first R is recognize. So not only does the athlete, but all of us need to recognize what the signs and symptoms of a concussion are. There are 4 main categories of concussions: sleep, cognitive, behavioral or emotional, and physical. So some of the sleep symptoms that may manifest are that they're getting too much sleep, they're not sleeping enough, they're having a hard time falling asleep, staying asleep, or they don't feel well rested once they do get to sleep and then wake up. Some of the cognitive symptoms that occur may be that they're feeling in a fog, they're having difficulty concentrating, understanding, or word finding while they're having conversations, and overall just difficulty learning. Some of the behavioral or emotional symptoms that may occur, they're more sad, they're irritable, they're impulsive or anxious. So these are all things to look out for. And then the physical signs, which are most likely what we will see outright as a bystander, but also what they will be able to openly express as well, especially the younger athletes, is including headaches, neck pain, dizziness, nausea, vomiting, fatigue, or sensitivity to light and sound. Headaches are the most reported symptom. So even if they have a history of headaches, taking a headache seriously if they have a mechanism that is consistent with a head concussion. So then once we know or recognize that there may be a concussive event, we need to know who to report to. So parents and coaching staff reporting to athletic trainers if they're available, school nurses if available, teachers, or their primary care provider, and making sure that we do keep the school administration in mind, because like we heard earlier, they are helping to manage the return to school aspect of concussive care. Once we recognize and we report that a head injury may have occurred, we need to stop all participation and play until we get a further evaluation, and then it's deemed safe for them to return to play. It is encouraged now, more research is coming out, that non-strenuous aerobic activity actually helps in encouraging oxygen to go to the brain, which helps heal the brain. So we want it to be sub-symptoms, so we don't want anything to increase their symptoms that they may be having, but non-strenuous aerobic activity is actually encouraged. And then we can offer other means of support through accommodation, notes, making letters of diagnosis, and stuff like that. next we have recover. So recovery is important. So early evaluation and intervention is likely to improve the outcomes of their concussive event. This should be an evaluation by an athletic trainer, a school nurse, or a physician. And then from there, they will go and make advanced referrals if needed. So an athletic trainer or a nurse would refer to a primary care, and then a physician could refer to advanced care providers like we just heard in the last presentation. Some of these include neuropsychology or a therapy of some sort. So we heard a little bit that in the previous presentation, but occupational and physical therapy are really big contributors to management of a concussion, but also speech language pathology therapists. So it is possible that you will also be provided medications or offered medications to help with sleep, mood, and headaches. But we do need to report side effects if any of these occur, but they can aid in recovery or some of the symptoms that occur with concussion. And then there are supplements that can help aid in healing as well. Therapy is beneficial in many ways. We heard from the last presentation. I'm a physical therapist, so I'm a huge advocate for coming to therapy for concussion, especially early. I see everything from the physical symptoms of headaches and neck pain, and also vestibular and ocular dysfunctions. But there are specialists that are specifically vestibular therapists, both in occupational and physical therapy. And then there's other types of ocular therapy through behavioral ophthalmologists as well that I have used in my concussion care. And then I've used worked with speech pathologists for the cognitive and speech deficits as well. So therapy is a good resource to have on your side, especially if you can get them in early. I've seen things improve quicker the earlier I can get them in versus more of the delayed onset of symptoms. So then finally, we want to return, which is all athletes' goals, is to return to sport. But in order to return to sport, we need to return to play or return to school first. And so this is where the school administration is a big help. We want to make sure they're aware of this concussive event, so that way we can make accommodations for school as we need. So this may look like starting with partial days and then eventually to full days, depending on what the athlete can tolerate. But we want to encourage a consistent schedule both with school and outside of school. So this includes their sleep and eating routines. We want to make them as routine and regimented as before the injury, so that way their brain gets back in that normal rhythm. We do probably need to encourage brain breaks, especially early on when they get back to school. And this may just include things like walking around the room, taking a break to eat a snack or get some hydration, just getting a change of scenery. So that way the brain just kind of gets a break for a second, can refocus, recharge, and get back to learning or whatever environment they were in. This is to help optimize cognitive and visual stamina. There may be modifications that need to be made during school, including the hardware. So maybe they need a bigger screen. They need to sit closer to the front of the classroom in order to have less eye strain or cognitive strain. They may need software adjustments where the screen is altered, where it's less bright, where there's speech to text or text to speech resources, where they talk into the computer and don't have to work on the visual or the typing and the dual tasking initially. And then there also may need to be changes to the environment, including, well, the biggest things are sensitivity to light and sound. So if it's a really busy classroom, it may be too much for them and they can't cognitively focus. So they need to be kind of in a quieter space. Or if the room is too bright, they may need dimmer lights. So once an athlete has completely returned to school, we can then look at returning to sport. And this is a guided and supervised progression, usually at least 6 days, where they're starting with subsymptom activity and then progressing all the way back to return to play, with each day progressing a little bit more activity, a little bit more contact, and then eventually full practices and a full game. So it's not 0 to 100, which is what most people think, at least in my experience, is that they think, okay, I have no symptoms, I'm ready to go play a game. It's not the case, because we need to make sure that as they return, the symptoms don't return as they increase their level of activity. And like the last presentation mentioned, that fatigue is pretty common. So we want to make sure that as they progress through this progression of returning to play, that the fatigue doesn't onset and cause potential other injuries, which is known for orthopedic injuries in general. If you're more tired and can't keep up, you can have a different type of injury. And we certainly don't want that. So then in general, there is no hard evidence that shows that we can prevent an injury or a concussion 100%, which is disappointing to say the least. but realistic. So there are ways that we can mitigate the risk of injury, especially concussion, by using judgment and caution with at-risk behaviors or sports. This is simply following and enforcing the rules. A lot of these rules are in place for safety measures. So when we start to bend the rules a little bit, we're putting our athletes at more risk of injury. Another way we can mitigate this risk is having properly fitted equipment, and then reporting a concussion when we suspect there's a possible head injury. So that's what you guys are all here to learn about, is what to look for to potentially report when a concussion occurs. So the absence of loss of consciousness. So just because an athlete does not lose consciousness does not mean the head injury was not severe. A lot of people don't lose consciousness. I actually have never seen an athlete lose consciousness as an athletic trainer for a concussion, but that doesn't mean that that injury is still not severe or could have long-term implications. So we do need to report even if that does not occur. There's no magic number for injuries that would deem an athlete ineligible to play. Every athlete responds differently. So just because this is maybe concussion number 2, 3, or 4, we don't want to withhold that information in fear that they may never be able to play because they're, oh, this is concussion number 4. I'm not going to be able to play anymore, so I don't want to tell anyone. That is not the case. Everyone reacts differently. So concussion number 1 may be a season injury or season-ending or career-ending injury, but concussion number 5 may be a career-ending injury for someone else. There is cumulative effects of each subsequent injury to the head. So we do want to be mindful of how many concussions there are, but there's no magic number that says, yes, you can no longer play. There are long-term consequences of repeated concussions. So we want to make sure that each individual injury is properly recovered and cared for with the healthcare team that we have. There's also no magic number of force required to sustain a concussion. So some athletes get hit square in the head and they get a concussion. Other athletes never get hit in the head and they still can get a concussion. So we need to be mindful, even if an athlete kind of rebounds and they don't hit their head, if they're complaining of or if they have symptoms that coincide with a concussion, we need to take those seriously still. And then lastly, everyone's brain reacts differently. So it's not fair to compare athlete A and athlete B to how they're responding to their concussive injury. Some people take 7 to 14 days, and that's pretty normal. Other people take 3, 4, 5, 6 months to recover from an injury. It really depends on how severe their symptoms are and how long they take to kind of decrease the severity of this. And then I think a lot of other presentations probably mentioned it, but these are a lot of resources that are available to the public. I really like the CDC's Heads Up program. It has a lot of digestible information. It's really easy to use and access, and it's up to date. So that would be what I would recommend. So short and sweet presentation. Does anyone have any questions?
We do have a question.
I actually have 2 questions. First of all, when you had the picture of the brain and you were going over the symptoms, cognitive, sleep, all those 4, where did that come from?
The Brain Injury Association.
Okay.
I found it online. Yep.
Okay. And then the other one, I know the slides weren't exactly like ours.
Oh, yes.
Okay.
Yes, I did not create the original content, so I modified it so it was easier for me to.
Well, I was curious as to explain the tough love PRN part of the advocacy.
So I took that out because I didn't want to. So my guess is that sometimes we need to give tough love that we're the bad guys. So I've had many situations where I'm an athletic trainer covering a weekend tournament. And on Friday night, there's an athlete who potentially has a head injury and I have to pull them for the rest of the tournament, and I'm the bad guy, and that's okay because I'm protecting them. But that's a lot of time where I've had experience where parents will go against medical advice and say they want to play despite potential head injury. And if they want to sign that, that's on them. But in my position, that's tough love of saying, yeah, we're done. And we're not going back. Luckily, with some of the places I've worked, we have a physician on call and they can get checked out and kind of see what's going on. But that would be my opinion on why that was included. And sometimes the parents have to be the ones that are tough love. Sometimes it's the healthcare providers. Sometimes I've had experience where parents are the ones pushing their kids to continue playing because they think this is the baseball tournament that's going to get them fame when they're 12 years old. And I'm like, that's not how that works. But so that's what I would say is probably where she was getting at with that one. Mhm. Any other questions?
I run into situations where parents aren't helping, I guess you could say, to be advocates, like their kids are in a hockey tournament and, the kids have been saying they've been having some lingering things like some headaches and stuff. And, I'll try to talk to them about that. And the dads are like, no, they're fine. This is just, he's always gotten headaches sometimes. And I'm not, worried about that. It's like the dads are pushing more than even the kids. And these are like 7th and 8th grade boys.
Yeah.
But what are some tips or some ways that I can try to, I try to break through to some of these parents, and it's.
Are you a parent as well on the sideline?
No, I'm a school nurse. So yeah.
This is hopefully information that they should be digesting themselves so they can understand the seriousness. It's unfortunate that there's so many old school thoughts that are like, oh, it's just a ding on the head. But the more that you can educate them on the long-term consequences that can occur from injury, the fact that an 8th or 7th grade player needs to continue playing in a weekend tournament where they have many, especially hockey, they have many years of growth for playing at a higher level. So this one game is not going to it shouldn't jeopardize their entire career because you think it's just a ding on the head. So I would say information that you've learned from today, if there's a way that you can talk with your coaching staff where they can have some kind of seminar, bring someone in to kind of talk to the parents, because I have noticed both in soccer, baseball, and hockey and football that those are big sports where concussions are pretty common. But and not to be biased by any means, but it seems to be dads more than moms that are like, oh.
These are select away from us. It's like, they're not like on site, they're and oh man, they're from Pennsylvania. Yeah.
Oh, I work with a lot of the hockey kids up at the Centene Center in Maryland Heights, and I have a lot of education that I do when I work with parents, especially with kids who have had multiple concussions, and taking the time to actually come to therapy and get them to do their exercises and see the benefit. Some athletes are great. They do everything they're told, and other athletes are like, nah, and then they don't get better and they wonder why. But educating as much as you can. And I know it's repeating probably what everyone has said all day, but sometimes it's hard to get through to those thick skulls, but they don't want it to be the time too late where they're like, and they go back in, they get a second hit. Now that we have second impact syndrome and we are potentially in the hospital. So until you can kind of get into them. Yeah. Going through the coaches may be helpful. If the coaches are on board with that, parents tend to listen to coaches a little bit more than other parents, unfortunately. Or if you have any parents on the sideline that are healthcare providers that may be able to since they have a background with it, but it is unfortunate. And I've experienced it far too often as an athletic trainer, unfortunately.
Well, Megan, want to thank you very much. It's a wonderful last session of the day. And on behalf of the Brain Injury Association of Missouri, I present you with a token of our appreciation. And for everyone in attendance, I think the message has been that share the information that you've learned today with people you work with. There are tremendous resources that have been mentioned today, including the CDC, Brain Injury Association of Missouri's website. If you look for concussion awareness now, I mentioned that's a new nationwide coalition. And the idea, it is not necessarily sport-related concussion, but they're looking at a lot of the slips and falls. One of the spokespeople for that group is Rebel Wilson, who slipped on a movie set, hit her head, and had a concussion and needed some time to recover from that. She also had pressure to get back to work, similar to what athletes feel. This actor felt the pressure to go back to work. So there's some videos on that site. There's some other information about just getting concussions checked that may resonate with the students in your schools more than some of the sport-related concussion. But I think there's a big group working toward this problem of sport-related concussion, and it's going to take all of us to help make a difference. And so thank you for attending today. Hope to see you again soon. Linda Newman has a question before we get going too far. Oh, yes. So there are evaluation forms on the table. If you could fill those out before you leave. If you need a certificate of attendance, those are available at the registration desk. Nothing will be mailed or emailed. So if you need something to prove you were here, bulletins are available at the back of church. Okay, thank you, everyone. Enjoy your weekend.